it's 11 a.m. here in Seoul. I'm Oh Soo-young at the Arirang News Center. We're breaking into our regular programming to bring you a live briefing from the South Korean health authorities on the coronavirus outbreak here in the nation. In just a few moments, we'll cut into the briefing at the Daejeon Government Complex with simultaneous interpretation available for you in English. There, Vice Health Minister Kim Gang-nip will be briefing us on the coronavirus situation in South Korea, filling us in on the details of the number of new infection cases seen as of midnight and what kind of efforts the government is making to contain the virus, especially with the cluster infection cases we've been seeing in the country. Looks like he's about to start the briefing now.
We also have sign language translation available today. First of all, here is Mr. Kim Gang-nip with the explanation on the COVID-19 situation.
8월 7일 금요일
Let us now begin our regular briefing for August 7th, Friday. As of today midnight, we have a total of 9 new local infections and 11 new imported cases. The total number of confirmed cases now stands at 14,519, and a total of 673 people are still in quarantine undergoing treatment. Unfortunately, we had one additional fatality, and the death toll now stands at 303. I extend my deepest condolences to the deceased and the bereaved families. This morning, the KCDC held a meeting presided over by Prime Minister Chung Se-kyun, and we discussed issues of the on-site inspection of the multi-use facilities like cafes and so forth, and also the restrictions of entry from people from the Hubei province of China, as well as the visa issuance. And Prime Minister Chung has said that we had a very unfortunate accident that happened in the Chuncheon City, Gangwon-do province, and he exerted all efforts to find the person who has been lost, as for the search rescue operations are underway. And as the country's trainee doctors are planning to go on and walk out today, he says that we have great concerns on a possible medical gap, especially at the emergency rooms and intensive care units. He stressed the importance of dialogue with the government and the medical circles. And due to the heavy downpour that has been witnessed in the metropolitan area and other parts of the country, many people are staying at temporary shelters, and therefore it is very important to abide by quarantine measures at these facilities. We are providing them with masks as well as hand sanitizers, and the facilities will also need to comply with the quarantine measures, including the screening of the body temperatures and so forth. And moreover, in order to prevent any spread of the waterborne diseases in these areas, we have also intensified our quarantine measures to this end, and also we have been operating an emergency scheme of the medical treatment, and we also have provided a service of a psychological and mental support for those who have been victimized as well. And at the cafes as well as other multi-use facilities, we have carried out our on-site inspection. And starting from yesterday, the cafe quarantine measures has been rolled out in separate with those from the restaurants. And users, when they make orders and when they are after and before consuming food and beverage, all of the users are mandated to wear face masks, and all of the facility managers need to wear face masks as well. And also, group meetings must be carried out only with prior reservations. And we will also consult with the related agencies and organizations, and we will also promote this campaign for the cafes and intensify the training of these managers as well. And we believe that we will also carry out on-site and randomized inspection together with the Ministry of Food and Drug Safety. And we believe that these intensified measures at cafes could also bring inconvenience to the public. However, we ask for your consideration and understanding going forward. And next, we have made some quarantine measures for the South Korean construction workers living abroad. On the July 24th, we have had the first batch of the Koreans coming from Iran, and we also have 216 people who has been isolated on self-quarantine. However, 214 of them will be dismissed today, and 2 of them have been tested positive, and they are currently have moved to the medical facility for treatment. And right now, we have about 9,300 South Korean workers working at 92 countries, and we also have many people living abroad, and many of them are living at nations with weak medical capacity, and they are living in groups and clusters, and we believe that they are prone to the risks of infection. Therefore, we will be monitoring the global pandemic, and we will listen to the opinions of these people living abroad, and we will also intensify our quarantine measures for these people. And as for the countries that have a lack of the expertise on the treatment of COVID-19, we will carry out a joint virtual conference with these countries, and we will also make sure that our quarantine supplies like face masks can be dispatched and can be provided to them as soon as possible. And if there are any South Koreans who have been confirmed with the virus, we will make sure that they can return back to Korea on a very urgently, and we will carry out our immigration as well entry measures to this end, and we will also carry out our sole duty of protecting the lives of our South Koreans going forward, and we will also provide our best efforts to secure a safe environment at the temporary shelters. And next is the entries on about the people from Hubei province, and starting from the April, we have also restricted these foreigners as well, the Chinese people coming from Hubei province in Japan, and we also have restricted the issuance of visas for the people from Hubei province. And right now, there are no more further additional cases in the Hubei province. And starting from the August 5th, the Chinese government has also eased the restrictions on the visa issuance on South Koreans, and therefore, starting from today, we will also ease the visa restrictions for these people from Hubei province. And next, we have a few words for the country's trainee doctors who are going on a walkout today. Despite many rounds of talks and negotiations, trials, many trainee doctors nationwide have been engaging in walkout today, and they are also very closely related to the public's health, as they also are engaged in the areas of ER and ICU. And to this end, the government exerts its great pity, and we will make sure that there are no medical gap for our public. And as for all of the hospitals with these trainee doctors, we will make sure that they have supplementary doctors and supplementary medical practitioners who can also treat the patients. And as for the emergency room medical facilities, we also made sure that they have supplemented medical practitioners as well. And we also have a monitoring system through our application going forward. And this morning, the Prime Minister presided over a meeting with the related ministries, and we also discussed issues of the emergency medical scheme that is going going to be placed in all of the local governments. And also we exerted our full efforts to cooperate further with the local authorities. And the central government will also monitor the situation on a close basis, and we will make sure that no people are disadvantaged from this massive walkout. And we also have a message to the trainee doctors. Regardless of the issue of the government's plan to enhance the number of enrollment of the medical schools, we ask you to comply with the negotiations and dialogue with the government. And we want to make it clear that our government's analysis of the newly released announcement was made, and because we saw the need of such supplementation and improvements, and we will continue to open our ears to the opinions of the medical doctors and medical circles, and also we will be devising better policies going forward. And together with the Association of the Korean Intern Doctors, we also have made negotiations, and we will continue this going forward. And also together with the Korean Doctors Association, we will make an consultative body, and we will also listen to the opinions and the suggestions made by the medical doctors here in Korea. We believe that the safety and the health of the public and the citizens are the common mission and common call of the doctors as well as the central government. And we believe that the patients and as well as all of our members of the public shall not be disadvantaged. And at a time when the COVID-19 as well as heavy downpour is also having great challenges in the country, we continue to want to engage in dialogue with the medical doctors. Thank you very much.
That was Vice Health Minister Kim Gang-lip updating us on the COVID situation in Korea. He just told us that there are 20 additional infection cases, bringing the accumulated total to 14,519. There was unfortunately an additional death, bringing the total death toll to 303. That wraps up our coverage of this morning's briefing. We'll be back with our regular newscast at noon Korea time. Bye for now.